Prema Kiosk Franchise Business Presentation. This presentation introduces the Prema Kiosk powered by Dr. Maya AI as a community healthcare access point and a sustainable micro-franchise business. Its key message is that early action can prevent a manageable infection from escalating into a medical, financial, and community crisis. Dr. Maya's Blue Code helps people recognize potential infection risks, isolate promptly, and avoid unnecessary entry into crowded waiting rooms where transmission could spread further. Meanwhile, Prema creates livelihoods for local Maya advocates. Operators can support elderly and vulnerable individuals, build trust within the community, and generate income through consultations, additional services, and local advertising. Prema is therefore more than just a kiosk. It is a model designed to protect families, reduce pressure on hospitals, and turn preventive healthcare into a dignified local enterprise. Slide 1. Transforming healthcare economics. We are entering a post-antibiotic era where preventing infection may become as important as treating it. This presentation introduces the Prema Kiosk and Maya Advocate micro-franchise, a decentralized model designed to bring early triage, health guidance, and community support closer to where people live. The economic threat of antimicrobial resistance. Antimicrobial resistance is not only a medical emergency, it is also an economic threat. This slide highlights projections of millions of deaths, enormous losses in global productivity, and a possible reduction in average life expectancy by 2050, illustrating why prevention cannot be delayed. The weakness of the doctor-centered model. Fear and uncertainty often drive potentially infectious patients into crowded waiting rooms. When vulnerable, infected, and healthy people share the same enclosed space, clinics can unintentionally become sites where resistant organisms and infections spread rather than being contained. Why people delay seeking help. Many people postpone action because visiting a distant clinic may mean losing a day's wages, paying high travel costs, or facing the fear of receiving a serious diagnosis. These barriers allow manageable health problems to worsen before help is finally sought. The cost of waiting. An infection may start with mild symptoms, allowing the person to continue working and socializing. Over the following days, the condition may worsen while the infection spreads to family members and the wider community, eventually leading to an emergency. The financial consequences. Late intervention can impose a significant financial burden through hospital admission, intensive care, costly medicines, and lost family income. The damage extends beyond the individual, as spouses, children, and colleagues may also be exposed before the infection is recognized. Slide 7. The Blue Code. Dr. Maya's Blue Code is designed to turn uncertainty into immediate protective action. When a combination of symptoms indicates a potential infectious risk, the priority is to isolate, avoid unnecessary travel, and seek professional advice before entering a crowded waiting room. Introducing the Prema Kiosk. The Prema Kiosk brings AI-supported health guidance directly into communities. Instead of requiring people to travel long distances, it provides a convenient local access point that can operate all day without fatigue or biological risk. Designed for challenging environments, the kiosk is built to operate even where infrastructure is unreliable. Solar power, battery backup, dual SIM connectivity, and weather-resistant materials enable it to function in rural areas during power cuts and in harsh climatic conditions. Accessible to everyone. Prema is created for those who may not own smartphones, read confidently, or understand complex technology. Users can speak naturally in their own language, while simple visual symbols guide them through the process. Changing the timeline. The usual pathway might involve waiting several days, traveling to a clinic, and seeking help only after the condition worsens. The Prema model aims to promote action from the first day, particularly isolation and appropriate referral, before the situation escalates to hospital-level care. The human return on investment. The greatest return is not solely measured in money. Early intervention can help families avoid catastrophic healthcare expenses, reduce unnecessary pressure on intensive care beds, and interrupt transmission before an infection reaches households or communities. The Maya Advocate. Technology alone cannot build trust. A local Maya advocate can assist elderly or vulnerable users to interact with the kiosk, answer basic questions, and connect the technology with the cultural and practical needs of the community. A sustainable community model. The kiosk offers free, quick access guidance, along with optional paid services and local advertising. This creates a self-sustaining microeconomy that can support the kiosk and generate income for the local operator. prevention instead of costly crisis management. The traditional model invests heavily in large hospitals, laboratories, and late-stage treatments. The Prema model proposes a smaller, decentralized investment that provides preventive guidance within communities and aims to reduce the need for expensive emergency responses. A community early warning network. A network of Prema kiosks could detect unusual patterns of symptoms across communities. When multiple locations report similar issues, public health teams could investigate earlier and implement targeted measures rather than waiting for a major outbreak to manifest through hospital admissions. The dual return. Prema delivers two types of return. The human return involves improved access, earlier action, and protection from avoidable medical costs. The business return is a scalable network of locally operated kiosks that creates employment and strengthens community resilience. The operator income model. This slide illustrates an income model for a Prema operator in India. Based on the stated assumptions, an initial contribution of 5,000 rupees could be recovered quickly, while moderate daily usage might generate ongoing monthly income, flexible working hours, and increased financial independence. These figures are projections and require validation through a real-world pilot. How the financial model operates. Projected revenues stems from interactions with Dr. Maya, additional services, and local advertising. After the foundation's share and estimated costs, the model shows a net monthly income for the operator, comparing this opportunity with traditional local employment. Actual earnings will vary depending on location, demand, pricing, operating costs, and regulatory requirements.